I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
The coronavirus pandemic has caused upheaval in the lives of many people, and the increased stress that it has caused is a very normal response. High levels of stress impacts people's physical health, how they feel, and how they think. To help manage stress during this pandemic, it is important to stay up to date with credible sources of information about how to keep yourself and your family safe, maintain connections with family and friends, while remembering to observe social and physical distancing. Practice relaxation techniques like deep breathing, yoga, meditation, stretching, and relaxing visual imagery. Focus on positive aspects of your life and any new opportunities that this situation is bringing to you. Engage in physical activity, even in your home. This helps to boost mood and reduce levels of stress. Stress levels can be managed by having a problem-solving approach, by managing the things that you can manage, and by adopting a positive attitude about your capabilities. This message is brought to you by the St. Kitts Mental Health Association.
Hi everyone, I'm Dr. Dwayne Archibald, Head of Emergency Room at Joseph and France Hospital. Novel coronavirus has been topic of conversation globally and of course in St. Kitts and Nevis. Basically, the word novel in coronavirus identifies that this is something new to the human being. In preparation of COVID-19 in St. Kitts and Nevis, we have to be able to identify the symptoms. These symptoms may include fever for a prolonged period of time, coughing for a prolonged period of time, shortness of breath, or any respiratory type symptoms. In addition, for prevention, we should avoid holding hands, shaking hands, sharing forks, knives, spoons, and even cups. So consider avoiding touching one's face, nose, mouth, eyes. So to avoid self-contamination, that is touching the face, we are advised to use alcohol-based hand sanitizers. Now these alcohol-based hand sanitizers should have at least 60 to 70% alcohol in it. We should also consider washing our hands thoroughly when handling babies before and after, also in the case of the sick and the elderly. So when I speak of sick people, I refer to elderly over 60, I refer to people with hypertension, diabetes, kidney compromise or kidney failure. Hand hygiene is important in cooking. We should wash our hands thoroughly before and after handling raw meat. Cooking boards should be separate for raw food and cooked food. And of course, the raw meat should be cooked thoroughly. For the pet owners, they should also consider washing their hands before and after dealing with pets. The virus can get on any other inanimate objects such as doorknobs, computer screens, computer keyboards, and we should consider wiping those down with Lysol or Clorox. Let us try to build our immune system. Exercise, rest, vitamins, vitamin C especially, also fruits and vegetables, and hydration, drinking lots and lots of water. There is a lot of misleading information being spread about the COVID-19, rumors, So what we do suggest is that you follow up with the Ministry of Health in terms of their Facebook page. Also, there's information that's readily available from WHO, World Health Organization, or from Caribbean Public Health Agency. So for further information on COVID-19, we can visit the social media outlets or social media pages of the Ministry of Health. So the St. Kitts Health Promotion Unit on Facebook, on Instagram, and also on YouTube. Or we can just call 467-1172 or 467-1108.
Extreme sadness and feelings of despair could be some of the things people are noticing in themselves during this unusual time. Pay specific attention to see if you have feelings of discouragement, hopelessness, irritability, difficulty concentrating, and disruptions in eating and sleeping habits. Pay attention to your emotions and talk to someone if they are feeling overwhelming. Focus on positive messages that you get from your environment. Listen to uplifting music, stories, or news items. Distract your thoughts by doing something like reading a book, doing a puzzle, coloring, or playing a game. Humor helps to lift moods. Watch a comedy or have a good laugh with friends. Remember your own strengths. What are some positive things that have helped you feel better in the past? Remember, if you have tried everything and overwhelming feelings of sadness still persist, reach out for professional help. This message comes to you from the St. Kitts Mental Health Association.
Currently, there are rumors and falsified reports circulating on social media about the novel coronavirus. For accurate information and updates, visit the Instagram and Facebook page of the Health Promotion Unit or the Ministry's YouTube channel at St. Kitts Health Promotion Unit or St. Kitts HPU. You may also visit online the World Health Organization or the Caribbean Public Health Agency. For further contact information, please contact the Ministry of Health for more info at 467-1172 or 467-1108. You can also be sure to follow the news to get the local COVID-19 updates. Let's all try to remain healthy and well. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
I am Officer Donnelly Liebert Shiverton. Do you want to travel and don't have private transportation? Here are some travel safety tips to keep yourself and the persons around you safe from the coronavirus. When venturing out in public, it is recommended that you wear a mask at all times. Sanitize your hands before and after entering public transportation. The bus operators are also encouraged to sanitize their buses after each trip. Remember, always practice good respiratory hygiene. That means refraining from touching your face with unwashed hands. Always practice physical distancing. To maintain physical distance, the government of St. Kitts and Nevis stipulates that only 2 passengers are allowed per row. That is, 1 passenger on each end of the bus row, while 1 passenger is allowed to sit up front with the driver. This means that only 9 passengers are allowed in a passenger bus. Remember, stay safe, travel wisely as we work together to flatten the curve.
The coronavirus pandemic has caused upheaval in the lives of many people, and the increased stress that it has caused is a very normal response. High levels of stress impacts people's physical health, how they feel, and how they think. To help manage stress during this pandemic, it is important to stay up to date with credible sources of information about how to keep yourself and your family safe, maintain connections with family and friends, while remembering to observe social and physical.
Stand by. Everybody, let's go quiet, please.
Good afternoon and welcome to the National Emergency Operations Center COVID-19 daily briefing for the 27th of April 2020. It is a new day. Thank you so much for tuning in, for joining us. We appreciate your company very much, wherever you are in the world. Today we will continue with our updates, bringing to you relevant and pertinent information with respect to the management of the COVID-19 pandemic here in St. Kitts and Nevis. We do have a lineup of presenters for you today, including the Director in the Department of Agriculture, the Director of the Department of Environment, the CEO of Digicel in St. Kitts, Superintendent Henry, our Chief Medical Officer, and Mr. Abdias Samuel. Before we get into the presentations, we are going to have a presentation from the National Housing Corporation. We invite Mr. Charles Morton, the General Manager of the National Housing Corporation, to make a donation to the NEOC from the management of staff of the NHC. Mr. Morton.
Thank you and pleasant afternoon to all. This afternoon, it gives me great pleasure on behalf of the team at the NHC, that's the National Housing Corporation. We have thought through this very carefully, and we recognize that the efforts of the NEOC, they have been tremendous, and we wanted to play our part. And so the staff and management got together and said, what can we do? And we decided, firstly, not only we want to make a monetary presentation to the efforts, but we want to also make it public that we are extremely, extremely happy with the presentations that go on and the work that has been going on continuously with this, on this effort. And so today, I am pleased to stand here as one of the team, the leader of the team, and to say that, Dr. Laws, can you come forward, please? On behalf of the management and staff, this is a contribution, strictly staff initiative. And so it's a small check, but it is significant. It's a check for $1,500 for the cause. So thank you.
Good afternoon, everyone. And we have been saying every day that we are in a battle, and it's the battle for our lives. And we did say that it's an all-of-society effort. And this afternoon, we want to thank the management and staff of the National Housing Corporation, NHC, for their kind donation. We want to say thank you, thank you, thank you.
And thank you to all of you, Dr. Laws and Mr. Morton. I would now invite Mr. Melvin James, Director in the St. Kitts Department of Agriculture, to give us a presentation. Mr. James.
I always look forward to the opportunity when I can share with the country, and particularly the farmers and fishers, so that we can be updated. Today, I'll emphasize farming, as shortly, maybe like as early as tomorrow, you'll have a specific presentation by Mr. Williams that relates to fishing. In discussing the life cycle or lifestyle changes brought about by COVID-19, often we speak about the new norm. And this includes things like social distancing and moving away from things like shaking hands, to name a few things. But how many of us extend our minds to the fact that there will also be changes on the farm and in the shipyard, and that these are likely to result in reduced production and delays in shipment? In the US, the agricultural business was labeled critical or essential. Hence, farmers were able to continue their production despite lockdown, and production progressed smoothly. Globally, the FAO reports suggest that there will be sufficient food, but in my opinion, there can be an issue with availability. For example, on April 13th, a CNN report states, as the virus pandemic shuts down businesses globally and sends countries into lockdown, the disruptions are threatening to cut off food supply chains and increase food insecurity. Here in St. Kitts, to avert food shortages, our government devised a stimulus package in the amount of $10 million. Today, I wish to update you on what the Department of Agriculture is doing about food security. Historically, we grow some 15 different vegetables. Some need a lot more water than others, like pak choy and lettuce. And we're in the dry season, so we cannot do all. But we have selected the hardier crops that mature quickly for this initiative. So we have selected things like melons, squash, pumpkins, sweet pepper, yams, sweet potato. Just about 2 weeks ago, the department met with over 80 farmers, and we asked them to double, even quadruple their usual production, which at this time range from between 5 acres, like in sweet potato, to a modest half acre in things like cabbages and carrots. I report to you today that these farmers stand ready to ramp up their production. Our research indicated that an initial interest in planting indicated that we had interest in about 38 acres of peanuts, 15 acres of squash, 20 acres of carrots, to record a few. We at the department are offering support in the form of free land preparation, free seedlings, free chemicals, free advice, even free help in marketing. As proof of our willingness and as proof of farmers' eagerness to engage, we ask them to sign a MOU. Naturally, in circumstances like these, farmer response will be overwhelming. In the coming days, we will in fact start production, but it is unwise to start with all of the crops and all of the farmers. So we will produce a schedule and try to include everyone somewhere within a 3-month cycle. Even as I wrap up, my dear audience, it is well and good that the government is pumping all of this money into farming so we can have much increased production in July.
Welcome back. And we do apologize for the break in transmission. There was a power outage. I would now invite Mr. Melvin James to continue with his presentation.
My dear audience, it is all well and good. The government is pumping $10 million into farming for increased production. But I think there is a big question. Will we, the locals, buy it? All of us, residents, we must begin now to think local and buy local. Local will never do well if we only buy when the boats do not come. I know we are imperfect. There are issues, for example, prices, and this is perhaps a major issue. There certainly is no doubt about our quality. We produce top-rated vegetables, pesticide-safe foods in the country. If we do not support local, the $10 million invested will be wasted, and we will remain food insecure just as we are now. We must eat what we produce and produce what we eat so that we could build jobs locally, empower our people, and be having food for ourselves. It is not just about government, it's about us all. So let us be so minded and prepare ourselves. As I wrap up, I just want to remind you about the opening hours at the department. The Department of Agriculture will be open next on Thursday morning to sell feed and crop supplies. The public market will be open Thursday and Friday from 7 to 2 p.m. And all those who have business with us, feel free. In terms of feed, right now we only have layer feed because we were expecting 3 containers. We only got 1, but we think that we should be able to get the other 2 out of the port later this week. We just apologize for any inconvenience, and we trust that you will not be too greatly impacted. Thank you, and I look forward to coming to you again shortly.
Thank you, Mr. James. One of the things that this COVID-19 pandemic has fostered is a new appreciation for those who feed the world. There has been no other time in recent memory when the critical role farmers and food manufacturers play has been as prominent. I now invite Ms. June Hughes, Director of the Department of Agriculture, to address us. Sorry, because I was talking about agriculture there. Director of the Department of Environment, Ms. Hughes.
Thank you, Mr. Williams. Good afternoon, all. I want to thank NEMA for the invitation to discuss the work of the Environment Subcommittee today. The Environment Subcommittee is comprised of the following members: the Director of Environment, who chairs the committee, and representatives from the oil companies, that is Delta and Sol, St. Christopher National Trust, St. Kitts and Nevis Defense Force, that is the Coast Guard Division, St. Kitts and Nevis Fire and Rescue Services, the Parks and Beaches Unit, the Department of Marine Resources, the Department of Maritime Affairs, the Solid Waste Management Corporation, Public Health, and representatives from NEMA on St. Kitts and from Nevis as well. The Environment Subcommittee is mainly responsible for assessing impacts to the natural environment with respect to any disaster situation. Prior to the onset of an event, the subcommittee is responsible for developing response plans for disasters, which should include recovery plans for ecological sites. In that regard, the Environment Subcommittee is responsible for not only conducting environmental damage and need assessments, but also in ensuring that personnel are trained in the assessment techniques. Currently, as hurricanes are one of our most imminent threats and pose the greatest potential for disaster, there is ongoing vulnerability assessments for key ecological areas, including our guts and watercourses, our coastal ecosystems, including beaches and reefs, and our forests. Prior to the onset of a hurricane, baseline assessments are conducted for each beach on each island, as well as assessments of each hiking trail. Following a disaster, damage assessment is conducted for each beach to identify beach loss and ecosystem damage. The forest is assessed for landslides and tree loss, whilst trails are assessed for damage and accessibility. Alternative roads that run through forested areas would be assessed for accessibility. Waterways are assessed for blockage, and in that connection, we are partnering with the Water Services Department from this year to assist with the assessments in the forest. As it pertains to COVID-19, the environment is probably the only sector that has benefited from COVID-19. While worldwide lockdowns and stay-at-home orders, the environmental ecosystems have actually been granted a much-needed reprieve from human interactions. It has been noted in many media articles that as vehicular and foot traffic have lessened, natural ecosystems and biodiversity have consequently begun to thrive. I am positive that when this is all over, there will be a marked decrease in global greenhouse gas emissions, a much-needed break for the climate system. Additionally, with the reduction in vehicular traffic and human activity overall, we are experiencing less air pollution, less pressure on our natural resources, and less impact on our flora and fauna. Whilst the consequences of the virus have been so detrimental to the human population and the global economy, it has conversely resulted in a much-needed breather for the planet. I pray that the lessons we are learning from this virus impact are not lost in the noise. We have not been kind to our planet, and who knows, maybe this virus is a planet fighting back. It is my hope that our new normal provokes us into taking a much-needed new perspective on how we can discover real and lasting solutions that will be mutually beneficial, not only for mankind, but also for the natural resources that sustain us. Thank you.
Thank you very much, Ms. Hughes. Of course, one of the things that they would have said is that with the COVID-19 and less motor vehicles on the road, that it has cut down on greenhouse gases, the emission of greenhouse gases. And so therefore, COVID-19 has done something good for the environment in that sense. I would now invite Ms. Dion Emtage, CEO of Digicel in St. Kitts, to address us. Ms. Emtage.
Thank you very much, and good evening to all of you who are listening and watching live as well. Thank you for the invitation to brief you on what Digicel as a company is doing for St. Kitts and Nevis. My name is Dion Emtage, and I am the General Manager for Digicel St. Kitts and Nevis, as was introduced previously. And I'm here to discuss some of the means by which we have been helping our customers and also our community in this time of uncertainty. As you are aware, it is more important than ever to take care of both ourselves and our community in the fight to stop the spread of COVID-19. Here at Digicel, our main focus is to ensure the safety and well-being of each of our customers and staff. Staying healthy should be everyone's priority. It certainly is ours. So today I'll be discussing some of the ways that we are trying to help our community during this time. We have implemented a number of safety measures in our stores under official government recommendations to stop the spread and ensure the well-being of our customers. The maximum customer capacity in our store is limited to 3 persons, and yes, we know that there are lines, but this is necessary to ensure that we enforce social distancing. We encourage our customers to adhere to all of our social distancing markers at each of our stores, and then there too also when they are just out shopping generally. We are asking that you all adhere because this is the best way to stop the spread, being a safe distance apart. We have also installed protective barriers in our stores. And in addition to that, our stores are equipped with check boxes, and we have also installed additional check boxes at Rams and in Best Buy here in both St. Kitts and in Nevis. It is also mandatory that all of our staff, whether customer-facing or not, as long as they're interacting with anyone else, they are to be equipped with masks, which we provide daily for them, as well as hand sanitizers and gloves for those customers who are also handling cash. We encourage all businesses to do the same. What are we doing for the community? Firstly, I'd like to speak that we have actually partnered with NEMA here at the NEOC. We have partnered with Mr. Samuel. We've partnered with all persons who are working on the front lines as best as possible to ensure that we keep them connected and keep them safe. We have also partnered with the Ministry of Education, as you would have been briefed prior, to offer assistance to 350 mobile students as well as 100 broadband students in Nevis for free. We want to ensure that students are equipped with the tools to continue their education. We have also zero-rated over 20 sites, which means that Digicel customers within our federation can use these sites for free without touching any of their credit or data allocations. What else have we done? We have increased our entry-level packages for our customers in Nevis so they have access to more bandwidth for broadband, and we've also added a free movie content for 60 days. We have also been donating PPE equipment to the people of St. Kitts and Nevis, and we have also ordered additional equipment as voiced to us by the CMO as well as by Mr. Samuel. This is all to assist frontline workers in the fight against COVID-19. We've also donated several devices with 3 services to the COVID response teams as part of our commitment to fight. Staying at home certainly is tough. We know that. We've been at home with you. And we want to make sure that you have every opportunity to stay connected when you are housebound. You don't have to come to a store to purchase one of our plans or to pay one of our bills. It has never been easier. I'm certain that all of you must know about our My Digicel app, which allows you digital access to what you would do in a store every single day. With the new My Digicel app, you can easily keep your plans, you can purchase recharge, and you can keep your account activated without having to go anywhere, and we encourage you to do so. We know that we are social beings as human beings, but this is the time for us to look at change. We therefore need to look at all avenues and all ways for us to remain connected while enforcing social distancing. In addition to that, we know that you are undergoing extreme stress, as we are aware that staying at home and the uncertainty of the times are playing on many minds within not only the Federation but globally as well. And this app offers you access to gifts from us every day and every week, with our Shake to Win features, giving you access to great prizes. In addition to that, we've created and launched a series of offers to assist our customer base during this time. Staying connected is hugely important these days. That much is for sure, and we're doing our best to make sure that the island remains connected at all times. One of the things that we have noticed is in this time, our voice calls are going up. 3 months ago, we were all connected via our fingers. We were using WhatsApp. We were using messaging platforms. Now is the time for us to just actually make a phone call. Keep into contact with the elderly folk who may not understand how to use these platforms. Make a call to them. See how they're doing. They're also lonely. They're also suffering just as we are. And we encourage you to look at every single possible way to stay connected. We've also extended our payment periods during this lockdown to prevent service interruptions. We're offering free upgrades to H&E customers, so that's our home and entertainment customers, for 3 months. We are offering free additional data to postpaid customers. We've already implemented that, so you're already receiving additional data. We've also launched a new campaign called Live Free, Pay It Forward, and that simply says, do what you do normally. When you activate a plan, you have a chance to be gifted with the opportunity to live free for the next 6 months. We will pay your utility bills. We will pay your phone bills. We will buy your groceries for you. We will pay fuel for you. And we are going to choose someone from every corner of the island, so from the north, the south, the east, and the west, in both St. Kitts and Nevis. And on top of that, you will get a chance to pay that forward. You can then select a person or a customer of Digicel, and we will give them a cash prize as well. We know that this is the time that you need help, and we are thinking of innovative ways to do that on a daily basis. These are dynamic times, and so therefore our solutions need to be dynamic. And we will continue to work and partner with all businesses within the Federation to ensure that we can offer you the best and possible means of staying connected. I urge you to take care of each other in this time. We would have heard from the agricultural sector and the environmental sector. These are the times that we need to take care of each other. It's not all about business as usual. This is business unusual, and we at Digicel are continuing to ensure that we can continue to foster the connectivity that you need, the offers that you need to remain connected with your friends and families, not just here, but overseas as well. We think that this initiative by this team that brings the daily greetings from and briefings, thank you very much. Daily briefings is an exceptional one, and we encourage you to continue doing this on a daily basis for as long as you can. We at Digicel want to thank you all for this opportunity to talk with you, and we do hope that we can speak with you in the near future. Thank you.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.
Welcome to Yes I, Mekai. I am your host, Mekai, and today we have an exclusive. The world is shaking up right now due to the coronavirus. We have with us the organism himself. World, meet Corona.
Extreme sadness and feelings of despair could be some of the things people are noticing in themselves during this unusual time. Pay specific attention to see if you have feelings of discouragement, hopelessness, irritability, difficulty concentrating, and disruptions in eating and sleeping habits. Pay attention to your emotions and talk to someone if they are feeling overwhelming. Focus on positive messages that you get from your environment. Listen to uplifting music, stories, or news items. Distract your thoughts by doing something like reading a book, doing a puzzle, coloring, or playing a game. Humor helps to lift moods. Watch a comedy or have a good laugh with friends. Remember your own strengths. What are some positive things that have helped you feel better in the past? Remember, if you have tried everything and overwhelming feelings of sadness still persist, reach out for professional help. This message comes to you from the St. Kitts Mental Health Association.
The symptoms of the
We want to thank Ms. M. Taj for her presentation from Digicel. Of course, another thing that the COVID-19 pandemic has done is that it has underscored the importance of technology. In fact, people are having to do things now using technology. Schools, churches, businesses, your own personal communication and so on. Technology, we see the importance of it. Or we see more of the importance of it at this time. I would now invite Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report. Superintendent.
Thank you, Mr. Williams. Pleasant good afternoon to all. As usual, it is my pleasure to be here and to present law enforcement report at this briefing. Over the last 24 hours, there were 2 arrests of persons who were in violation of the curfew regulation, bringing our total arrests to 95 to date. This morning, at about 5 a.m., law enforcement conducted a vehicle checkpoint at various points around Bastille. A total of 75 vehicles were stopped. 20 of them were found to be in violation of the curfew, and the vehicles, drivers and occupants were asked to return to their residences. The other 55 vehicles were persons who were exempted. Additionally, 10 persons who were found walking on the street on their way to line up at business places, and they too were also asked to return to their residence. A further 15 persons were found exercising on the streets before 6 a.m. Likewise, they were asked to return to their residences. This is a total of almost 50 persons who were found on the street prior to the end of the curfew. We continue to make appeals to residents to respect the curfew and to stay at your residence during the curfew hours. I remind you that the curfew begins nightly at 7 p.m. until 6 a.m. on limited operation days. 6 a.m. the following day on limited operation days. Law enforcement continues its vigilance in keeping our residents safe, and I'm happy to report again in week 17 of 2020, we recorded a reduction of 39% in major crimes compared to the same period last year. And in week 1 to 17 of 2020, we recorded a total of 41% reduction in reported crimes compared to the same period in 2019. So a 39% for week 17 of 2020 compared to week 17 of 2019, and a 41% reduction for week 1 to 17 of 2020 compared to week 1 to 17 of 2019. In closing, I want to remind residents that the curfew will be in effect from 7:01 p.m. this evening until 6 a.m. tomorrow morning. This means that you must shelter in place at your residence, except if you are an essential worker or is required to report, an essential worker who is required to report for duty, or if you need to access emergency medical services. Thank you.
Thank you, Superintendent Henry. I now invite Chief Medical Officer, St. Kitts and Nevis, Dr. Hazel Laws, to give us her report. Dr. Laws.
Thank you, Mr. Williams, and good afternoon again to everyone. As of Monday, April the 27th, 2020, at 3 p.m., the World Health Organization reports 2,858,635 confirmed cases of COVID-19 globally, with almost 197,000 deaths. To date, 293 persons have been sampled and tested, with 15 confirmed positive, 259 confirmed negative, and 19 results pending. There are 4 confirmed cases of COVID-19 who have recovered, and to date there has been 0 deaths. Currently, 5 persons are quarantined in a government facility, while 84 persons are quarantined at home. 11 persons remain in isolation, while 662 persons have been released from quarantine. Today is a limited operation day, and it has been observed that a significant number of persons were seen in public spaces in Bastille without a face mask or with inadequate homemade masks. We would like to use this opportunity to remind persons that once you are in a public space, you are required to wear an appropriate face mask. Data shows that individuals can spread the virus to others without even knowing that they are or they have COVID-19. A significant proportion of persons who have the new coronavirus have mild or no symptoms. Additionally, if someone develops symptoms, they are able to transmit the virus before symptoms appear. The use of the cloth face mask prevents the wearer from spreading the virus-laden droplets, even if they are not aware that they are infected. Please note, children 2 years and under are not required to wear a mask. Please be reminded that the Statutory Rules and Orders number 15, Section 15, entitled Wearing of Mask Outdoors states, and I quote, "Notwithstanding the provisions of the Small Charges Act, a person shall wear a face mask covering their nose and mouth when in a public space, once a period of emergency is declared in relation to COVID-19. Residents and citizens of St. Kitts and Nevis, we are currently under such an emergency. As such, we are all to abide by the regulations being enforced at this time. Failure to comply with these regulations may result in summary conviction to a fine not exceeding 5,000 XCD dollars or a term of imprisonment not exceeding 6 months or both. Remember, your actions count. If we are to succeed in reducing the impact of this pandemic on our federation, we must work together. Maintaining the overall health of the people of the federation continues to be our individual and collective responsibility. I want to use this opportunity to remind you that national statistics and other COVID-19 related information can be found at the official website www.covid19.gov.kn, the St. Kitts Health Promotion Unit Facebook page, and the St. Kitts Health Promotion Unit YouTube channel and Instagram. I thank you.
Thank you very much, Dr. Laws. Well appreciated. The report on the COVID-19 situation in St. Kitts and Nevis and in the world. I now invite Mr. Abdias Samuel, who is the chair of the COVID-19 National Task Force and the National Disaster Coordinator at NEMA, to address us. We have to remember that, the hurricane season is coming up on June 1st.
Thank you, Mr. Williams, for such a kind reminder. Good afternoon, all. Those of you logged on via internet, watching via television, and listening via radio. Thank you for joining us today, 27th of April. I want to start by some abstract that I've made from presentations I've witnessed over the past weekend. One, I will start with Ms. Mtaj. It's not business as usual. It's business unusual. Two, while being on Inside the News with the Honorable Prime Minister, a caller called in and he admonished you, the general public, and us to watch your needle as it regards to spending. Watch your needle. I wanted to remind you to watch your needle, and it is not business as usual, but unusual. 311. There were a total of 16 calls for the past 24 hours. 16 in St. Kitts, 2 received on Nevis. 911, 121 calls. The NEOC and St. Kitts would have processed a total of 3 calls. 1 utility related, 1 for donation, 1 medical. The EOC and Nevis, 2 calls for the past 24 hours. Persons who require psychosocial support are asked to leave their contact numbers when they call 311, and the counselor will contact you. This is to reduce the cost of phone charges to the persons requesting the service. So 311, when you call 311, you call, you leave your information, and we will ensure that a counselor will reach out to you and call you. The COVID-19 Compliance Task Force continues to do its work, and I want to commend them highly for this week. They continue some educational process, but they are in the process of evaluating the progress that you are making. Today, they evaluated a total of 59 businesses, and they would engage 4 passenger buses. And they are categorized in the following manner: retail, stores, 30, insurance companies, 3, barbershops, hair and barber services, 6, automobile services, 3, courier and shipping services, 3, architecture and construction, 1, medical services, 6, legal services, 1, financial services, 3, real estate, 1, and utilities. Electricity department was also inspected today. The significant areas of improvement that we are seeing is in the personal hygiene. Practicing good hand hygiene was a total of 94%. Availability of hand sanitizer, 60% alcohol base. They're about 100%. Soap and water readily available, 90%. The weakest areas that we found were rum and bar shops are still attempting to do business. Liquor sold by retail. In transportation, no more than 2 persons per row. That was very poor. Passengers not wearing the mask, that too was very poor at 6%. Windows fully open or partially open, again, that was very poor on the buses, 6%. Doorknobs and handrests sanitized after every trip, that again was very poor at 6%. These statistics are going to drive the decision-making process. And I again want to appeal to all businesses, bus drivers in particular, ferry operators, to continue to comply with the agreed protocol. The task force observed general compliance with the regulations. However, they have expressed concerns that persons traveling on the passenger buses were not wearing the mask, although it was evident that they had their mask around their necks or in their possession. So therefore, it doesn't make sense you have the mask around your neck, or have it tucked in your bag or in your pockets. Dr. Laws just made a very fervent appeal to you to ask you to wear your mask in public places in accordance with the regulation. I therefore appeal to the general public and the bus operators to ensure for your own safety that the passengers that you have to care about comply with the regulation and wear the mask, but in particular for your own safety. The quarantine task force continued their work today by visiting a number of persons who were in quarantine, and I want to laud the efforts of the general public. General public persons are calling, in particular family members, and they are reporting persons who they know supposed to be in quarantine. Again, let me remind you that this is no time for we to ask you to go back home. This is time where we're going to make an example out of anyone that we find breaking the quarantine and isolation protocol. You will be fined a fine of $8,000 maximum, or you will serve time in prison. So you make up your mind. It's for the general safety of everyone. Please be conscientious of that. So again, I make the appeal, persons who are in quarantine and isolation, please stay at home. We are receiving calls that these persons are jumping on buses and they are coming to the Bastia area. We are receiving reports that persons are leaving their homes when they are supposed to be in quarantine and are going to public places. That is not correct. That is not right. Think about your fellow men and women. I want to thank a generous donator that took into consideration that we have some birthday celebrants for the month of April. And this generous donator, who wishes to remain anonymous, gave a wonderful cake just for the birthday celebrants. I guess they know who they are. I also want to acknowledge Dr. Bernal Nisbet and Rubina Nisbet for making a generous contribution to the fight against the COVID-19 and St. Kitts and Nevis with a donation of 2,000 EC dollars. 2,000 EC dollars. Thank you, Dr. Bernal Nisbet and Rubina Nisbet. Your contribution is well noted and appreciated. With that said, I want to continue everyone to continue to adhering. Oh, yes. There is also a hallmark moment attached with the contribution made by the Nisbet family. And the hallmark moment states, "This world needs more people like you." To the Honorable Senator Wendy Phipps, the health team, and all the frontline workers, from Mistress V. Nisbet, and I will also include Dr. Bernal Nisbet. Thank you. That's what the card says. These are the little things that move us on a daily basis to continue what we are doing. With that said, thank you, and we look forward to your questions and engagements. Mr. Williams, both there.
Thank you, Mr. Samuel. We had another cake, and the donator of this cake is the kindred sister of Vesta, Donna Manchester. We thank you for the cake in celebration of birthdays. We have a lot of April borns that sit in this room. We now enter the question and answer segment for today. And the first set of questions go to the doctors in the room, that is the medical doctors, Dr. Wilkinson and Dr. Laws. We will start off with Dr. Wilkinson. There are two questions for him. Is it safe to wear my contact lens with COVID-19, or am I at increased risk as you warn about not touching your face and eyes? And the second question, can I catch COVID-19 from the feces of someone if I am nursing them and changing Pampers? Dr. Wilkinson.
Thank you very much for those two questions. Just before I answer those two questions, I just want to highlight something that the CMO mentioned in the statistics that might have not been taken notice of, in that from the 19th of April to today, which is about 1 week, we have remained at 15 positive cases, and we continue to test. We had a total net number of tests of 36, and a total net number of negative results of 47, which shows that we are continuing to test and we are getting a significant number of negative results from the significant contacts, so that is good news. Now, as it relates to the question of contact lenses, there is no evidence to suggest that wearing contact lenses put you at any increased risk for catching COVID-19. We, however, speak about the fact that if you continue to put your contaminated hands to your eyes or to your nose or mouth, you can increase the risk of you getting COVID-19. And so what we ask contact wearers to do is to make sure that they practice the proper hand hygiene, making sure that you wash your hands with soap and water and do whatever is necessary for you to keep your contact lenses clean, and that would significantly decrease your risk. As it relates to feces, that's a very good question, in that some of the early studies show that the virus might have been present in the feces. However, to date, there is no evidence that the virus can be transmitted by the fecal-oral route, meaning that if, for example, the feces got on your hands and it was contaminated, and you happen to put your hand to your face or mouth, that the virus could be transmitted. So if you are caring for someone and having to change Pampers, yes, you should wear gloves, you should make sure that you have all the sanitary things in place, but that would not increase your risk for getting COVID-19.
And these are for Dr. Laws. We hear all the time of the ill effects of cigarette smoking. Are smokers at greater risk of getting COVID-19? And the second question, we asked about the use of the other two private labs in the testing for COVID-19. Do you have an update on whether or not the other two private labs are doing PCR testing?
Thank you for reading those two questions, Mr. Williams. Now, the first question speaks to smokers and are they at an increased risk of getting COVID-19? Now, smokers are particularly vulnerable because the act of smoking involves the use of hands, fingers, touching a potentially contaminated cigarette. And so a smoker runs the risk of introducing the virus from hand cigarette to mouth and into their systems. And so, yes, smokers have an increased risk of picking up the COVID-19 virus. Now, there are some cultures where they practice communal smoking, which involves the sharing of smoking products like water pipes. And so this facilitates the transfer of the virus from one person to another. And so, one needs to be careful in so doing during this pandemic. Now, smokers, if there are individuals who have been smoking for a prolonged period of time, chances are they may already have lung disease or reduced lung capacity. Now, if such individuals pick up the COVID-19 virus, their risk of developing moderate to severe coronavirus disease is higher than the norm. And so we are, pleading or recommending, that smokers be particularly careful in terms of reducing their risk of exposure to the virus. Now, in terms of the 2 private labs, so we made contact with the 2 private labs earlier this morning, and at present, meaning the 2 other private labs, they are not offering the PCR testing at present. However, they have assured us that they are in the process of procuring the thermal cycler PCR machine, and very shortly they will be offering the molecular testing to the general public. Thank you.
Thank you, Dr. Laws. This question is for Dr. Wilkinson from Sugar City FM 90.3. Having such a vast knowledge and many years of experience in the medical field, how do you compare your past experiences to this present one, dealing with the coronavirus? And having the CMO, Dr. Laws, and the rest of the members of the COVID-19 task force working along with you. Could you tell me the experience you are gathering at this moment? And is there anything that you see that you and the task force can improve upon? Dr. Wilkinson.
Okay, I started medical school in 1984, so that's, I think, about 30 plus years that I've been in medicine. And in the 30 plus years that I've been in the medical field, I have never experienced a pandemic, and I don't think anyone here have ever experienced a pandemic. And so this is new for all of us. And when you're in a new situation, you have to pull upon all of the experiences that you've had throughout your entire life, not just in medicine, to address the pandemic. I am happy that I'm working with a team of experts. I'm happy to be working with Dr. Hazel Laws. Sometimes when you're working in a tough situation, it's important for you to have a good relationship with the person that you're working with, and you get along, you can bounce off ideas, etc. And teamwork is very important in medicine, and I believe that we have a nice, solid team, and that's the most important thing. Being a surgeon, usually we tend to cut straight to the point, and this is one of the first times I'm in a situation where I'm having to do a lot of reasoning, etc., with persons to get the message across about the non-pharmaceutical methods that we have to address the public with. And so the greatest challenge is really getting the message across to persons, but I do hope that you listen to our plea and you abide by the simple things that we say. Wash your hands, don't touch your face, social distancing, cover your nose, cover your mouth, and with that, and with your help, we'll be successful. Thank you.
Thank you, Dr. Wilkinson. This question is from Mrs. Alicia Daniel Blake, Sugar City 90.3 FM. I have observed that individuals have mostly been wearing their mask when going about their affairs on partial curfew days. In fact, it now seems to be a fashion statement for some. However, it appears that some of the cloth, the washable masks, do not fit properly, and the wearers seem to be constantly adjusting or pulling them up, and in the process, touching their faces. Also, some of the masks seem to be in need of a good wash. Any advice on the fit of the mask, as well as how long should a mask be worn before it is washed? Possibly, should the wearer have more than one mask? Who would take that? Dr. Laws.
I must begin by saying thank you for your observations. And the wearing of the mask should fit, appropriately across nose and mouth. And then some are tied behind the ears, some behind the head. And so we advise persons when in public spaces to wear your mask as directed, in terms of it should be covering your nose and your mouth, and it should be properly tied behind your ears or behind your neck. And that's the first point. And two, the masks are either disposable, in terms of you should dispose of the mask properly after each use, or if it's the homemade or locally made cloth mask, they should be washed at the end of every day. All right, and so the masks, if they are locally made from fabric, they should be washed at the end of every day. And so that's the advice I'll give at this time. Thanks.
Thank you, Dr. Laws. This question, I had an employee who was confined to isolation at home. How would I know if the person has been released from their isolation and that it is now safe for them to rejoin the workforce? Should I just take their word for it?
All right, so to date we've had 15 confirmed cases of COVID-19. They were isolated at home. One or two of them were admitted briefly, but isolation took place at home. Now, at the end of the isolation period, the confirmed case would have gotten 2 negative RT-PCR results. And so they would be deemed viral free, and they would have recovered from the disease. And so this information can be appropriately communicated to employers. Persons, however, contacts of the cases could have been quarantined at home. Now, at the end of the quarantine period, again, the public health team, the district medical officer, and the nurses usually visit. They evaluate the patient, and once the individual is stable, most of the persons who are in quarantine were tested, and once they would have gotten back a negative RT-PCR test, they could exit quarantine. And again, this information can be appropriately communicated to employers.
This question for one of the doctors in the room. Are the frontline workers being tested periodically, seeing that they are the ones exposed directly to individuals who are confirmed cases and also quarantined individuals? If not, why not? And should they be tested? Dr. Wilkinson.
Thank you for the question. We have said repeatedly that anyone who should be tested is being tested, and the persons who should be tested are persons who are symptomatic or persons who had any significant contact. And I assure you that that is being followed all the time.
I would like to add that our frontline health workers, they are appropriately attired given the task that they are doing. So those frontline workers who are sampling and testing individuals, they wear the full personal protective gear, equipment when doing so. The frontline workers in the emergency room, they are properly attired. The EMT staff, when they are making calls for respiratory-related cases, they are also appropriately attired. And so the risk to our frontline workers is reduced because they are appropriately attired. Thank you.
Regarding the students returning from Jamaica, will they be going into a government quarantine, since these are potentially imported cases and can infect their families, especially in light of the fact that we are easing our way back into a state of normalcy? Mr. Samuel.
Thank you for the question. And yes, it's the policy. Anyone who will be entering St. Kitts and Nevis, in particular nationals, there will be quarantine, a mandatory quarantine for 14 days in a government-controlled facility. Thank you.
This question is for the Attorney General. Have the authorities already given consideration to how soon we can expect our borders to reopen?
Good afternoon to everyone. Yes, this is a consideration that has to be before the government, the cabinet, but we have consistently said, and we will continue to do so, to rely on the advice of our health professionals. Our Chief Medical Officer and the Medical Chief of Staff and their team are constantly monitoring the state of our fight against COVID, and when they consider it appropriate, they will advise the cabinet for us to make an informed decision. The borders remain closed, and there are times when there is permission given when citizens of a foreign country may request to be repatriated to their home. A charter is allowed in. The attendants on that flight do not exit the plane, but those who are here are allowed to exit. We do have, from time to time, cargo flights and other flights that come in with medical and other types of supplies that are critical to our life here. We do have food shipments and cargo ships that come, but our borders will remain closed to commercial traffic, and we would allow nationals, if they come appropriately. We cannot deny our nationals, but as you have just heard, they will be quarantined in a mandatory public facility for a minimum of 14 days, again on the advice of our Chief Medical Officer and the medical team. Thank you.
Thank you, Attorney General. This question is for Superintendent Henry. 90+ persons arrested to date is a high number, especially given the high level of publicity that there has been with respect to the regulations? Are you convinced that the vast majority of the persons arrested have simply and knowingly breached the regulations, or did some persons genuinely appear not to be aware of the regulations?
As you would have gathered by now from my briefings, that the police are very tolerant. We will question persons about the reasons why they are out and satisfy ourselves that they are deliberate in their actions before we take the decision to make an arrest. So if a person is found out and he gives a reasonable explanation for himself being out, then we would consider the course of action. But when we decide to arrest and charge, it is because we are satisfied that the person is deliberate and he has to pay for his actions.
Thank you, Superintendent Henry. This question is for the Director of Agriculture, Mr. James. Farmer initiatives sound very encouraging. However, what is in place for householders with respect to backyard farming?
Thank you, Inquirer. In some of my earlier briefings, we had spoken more about the backyard. So I'll update you that to date, we have also included our backyard gardeners and homeowners, community gardens. In fact, we've already distributed almost 5,000 seedlings to well over 178 backyard gardeners, community plot workers. And we have some seeds sown in the ground again, which should be ready in another 2 or so weeks. So food security, yes, it's not just about the bona fide commercial type farmer, but we're also looking at those persons who can do things at home and help themselves. So we've given out seedlings, we will be doing some more, and we have a team. The staff, Mr. Vorsels, for example, has been tasked with being in charge of backyards, and there are other persons who have also helped and volunteered. So we'll be coming around and we'll be looking at what you're doing and giving assistance. So backyards are also on board. Please be so guided.
Thank you, Mr. James. This question is for Mr. Abdius Samuel. Why are the Spanish bars at Baker's Corner and Newtown, why are they still having their club gatherings at night? And they were told to implement social distancing. The security officers need to investigate what is going on behind those closed doors.
Thank you very much for your observation and thank you for the question. It's a serious matter. However, I cannot substantiate what you said because I don't visit those areas and I don't know what is happening behind the closed doors. However, I would say to you that we will continue to educate and engage that community, the Spanish community, to ensure that they become compliant with the law. Thank you.
Thank you, Mr. Samuel. This question is for the CMO. Does a person have immunity when they would have been deemed recovered from the COVID-19 virus, or are they still susceptible to being reinfected?
I'll begin by saying that the coronavirus disease is a new disease, and there is much about this disease that we are still learning, and there's much about this disease that is still uncertain. Now, when you would have recovered from coronavirus disease, yes, your body's natural immune response would produce IgM and IgG antibodies. These antibodies are proteins floating around in the blood, and it provides you some immunity or protection from the same virus. What we do not know as yet is how long this immunity would last, how long this protection would last. So at present, we are the scientists, they know that there is immunity. Persons who would have picked up SARS-1 or MERS, Middle East Respiratory Syncytial Virus, their immunity lasts for a few months to probably a year or two. But for the coronavirus disease, we are not sure how long the immunity lasts for. Thank you.
Thank you, Dr. Laws. This question is for Superintendent Henry. Noise and loud music in particular, is a major issue, particularly on lockdown days. What can one do if they are being disturbed?
Every citizen enjoys the right to enjoy his peace and quiet at his residence. So if you are disturbed by noise from someone else, I would advise that you call the police station and make a report, and the police would ensure that the noise is kept at a reasonable level where everyone could coexist.
And this is our last question for the day. For the Attorney General. The Attorney General of the United States, Mr. William Barr, on Thursday last week held a conference call with more than 500 faith leaders. According to the report coming from the media, he sought to assure them that the Trump administration is on guard against overzealous state governments which seek to unnecessarily extend measures against religious organizations practicing their faith. Sir, after SRO 15, the Prime Minister has eased restrictions on barbershops, salons, bus operators, construction, etc. But yet the church appears to be systematically closed. In our Constitution, the right to assemble and practice one's religion are guaranteed. Is this a systematic effort to further silence the voice of the church?
Thank you for that question. This certainly is not a systematic effort or any effort at all to silence or restrict the church. Our Prime Minister has said that we adopt the policy of the WHO, the World Health Organization, that states very clearly that each country has to follow its own dictates in the fight against the coronavirus. We have embarked upon a state of emergency to be able to fight this dreaded disease that's taken over the world. And in so doing, that state of emergency suspends individual rights that we hold dear so that we can appropriately fight the virus. So whereas the right to assemble, as you so correctly state, the right of conscience to practice your religion, as you so rightly state, would be suspended because of public health emergency. This is clearly stated in our Constitution, that under a state of emergency, Section 19 of our Constitution, Section 12 and 13, rights of assembly, rights of conscience, are suspended because we have a public health emergency. We know that the religious, faith-based associations of the Christian Council, the Evangelical Association, have written to say that they support the work of the National Emergency Operating Center, the work of our health professionals, because they have the same deep interest in our citizens as the state has, as this government has. The faith-based associations have stated that many of their members are elderly and vulnerable to the coronavirus, and that they would not want to place their elderly members at risk. And so that they would rather they stay at home and they will find ways to pastor to them virtually and otherwise. But they would support the fact that we would not want to have mass gatherings as we have in churches, so that there could be the transmission of the disease. And we ask all our citizens to understand and support those regulations, those recommendations of our health professionals to protect each and every one of us. This is absolutely no intention of the state to wage war on any faith-based organization. It's absolutely not the intention of the state to wage war on anyone, but is done for the protection of each and every one of our citizens. The priority of this government is to protect the health of all our citizens. And that is why we have passed the regulations to assist our health professionals to help us fight this coronavirus, where many people in other lands have died. Thank you very much.
Thank you, Attorney General. Just to add that in the Acts of the Apostles, the post-Easter church, there was no such thing as churches as we have today, which are elaborate buildings and cathedrals and so on. The church was really in the home. It was in the family. It was the domestic church. That is where people gathered and had church. It is true that we can't move from one home to a next home, but really and truly it is the family that must pray together. And so therefore families can have their own prayer service. They can, and it's a time really to bring young people in the home and so on, and to introduce them to the Bible and to prayer and to reflection. They can sing and all of that within the family itself. And that really is the family church, where people can grow spiritually. They can grow in terms of their knowledge of the Bible, of Scripture, and so on. And that is also important. It is true that there is a challenge at this time with the COVID-19 pandemic in terms of churches are struggling in terms of keeping connected and their connection with their congregations and things like that. Some are struggling with the use of the technology. But at the very same time, what the Attorney General said is important. It is more important to save lives than anything else. Faith must go along with reason. Having faith does not mean that you are foolish. Having faith doesn't mean that you don't exercise your common sense and your knowledge. That is important, and so therefore faith and reason must go hand in hand. And if faith doesn't go hand in hand with reason, then it is tantamount to superstition. And that is my 2 cents. We have come to the end of today's briefing. The questions have been answered, I hope to your satisfaction. But always you can have a follow-up question. If you think that something was not answered to your satisfaction, you can have a follow-up question at the next briefing. I would like to thank Mr. Melvin James, the Director in the Department of Agriculture in St. Kitts, for his presentation. Ms. June Hughes, Director of the Department of Environment, for her presentation. Ms. Dion Emtage, CEO of Digicel in St. Kitts, or the General Manager of Digicel in St. Kitts. Superintendent Cromwell Henry, Chief Medical Officer Dr. Hazel Laws, and Mr. Abdias Samuel, Chair of the COVID-19 National Task Force. So we have had some key elements today in today's briefing. The importance of food security, agriculture. The importance of the environment, Ms. June Hughes. Technology, Ms. Dion Emtage. Law enforcement and order, law and order. Health issues pertaining to the COVID-19 pandemic. And Mr. Abdias Samuel, looking in terms of disaster and disaster management and so on, all important aspects of how we manage the COVID-19 in St. Kitts and Nevis. I also want to thank Attorney General and Chair of the Disaster Mitigation Council, the Honorable Vincent Byron, and also Minister of State with responsibility for health, the Honorable Wendy Phipps. I also thank Mrs. Christmas Jacob for her service each day in sign language, and I thank the media houses and ZIZ for facilitating this COVID-19 briefing each day. Tomorrow we will be back, and also Dr. Wilkinson, Dr. Cameron Wilkinson, Medical Chief of Staff. I thought I did mention his name. Right, so tomorrow we will be back for another daily briefing at 5 p.m. Until then, be safe and continue to follow the regulations with respect to the law and all the things for your personal safety and hygiene. Take care. See you tomorrow.
Fear of the coronavirus, along with misinformation about its spread, could lead to stigma and discrimination towards people contracting the disease, their families, and even healthcare workers. Stigmatized people may be subjected to social avoidance, bullying, and acts of aggression and physical violence, which could have a detrimental effect on their mental health. To help reduce stigma and its impact, you can share accurate information about the virus and how it spread. Speak out against negative statements shared on social media sites, and don't share such videos. Don't refer to coronavirus victims or cases. They are people with COVID-19. Do understand that stigma and discrimination make it harder for people to seek care for the disease. Do your part to reduce fear and discrimination. Be responsible with what you share. This message comes to you from the St. Kitts Mental Health Association.
To avoid getting the coronavirus, remember to wash your hands thoroughly and frequently before and after preparing food, after using the toilet or changing a diaper for a baby, sick person, or the elderly, after blowing your nose, and after leaving large gatherings or moving away from persons who appear ill. Encourage others to wash their hands and also use an alcohol-based hand sanitizer of 60 to 70% solution. Stay away from events having large gatherings of people. You can expose yourself to more possible infections in large groups. Also, avoid sharing cutlery, cups, glassware, etc. with others. Viruses can linger on these items and may be transferred this way. Avoid shaking and holding hands, and hugging or keeping an infected person in close proximity. This is a message from the Ministry of Health and the National Emergency Management Agency, NEMA.